folks that testified on that. I've gotten them written down. So there's some folks online. And then we'll work that bill. And then finally, we'll take up public comment. I've spoken with the Representative McCann. I think I can represent that he presented the bill, but now we'll take public comment. Public comment is going to be timed. So we're going to, on all of these, it'll be a couple minutes, 2 minutes. And we're going to get through these. As you know, we've got 2 more bills behind these. So we're going to work these bills. And then we've got 2 more bills. I've spoken with both of the sponsors, and they know that theirs are in jeopardy the longer these first 3 go. So keep that in mind. I think we're all are present. We're not going to worry about a roll. Why don't we go ahead and Representative Brown, why don't you go ahead and make any closing comments you'd like to before the committee takes up your bill. We're on House Bill 164, medical prescriptions, off-label purposes. Please proceed.
Thank you, Mr. Chairman. I will be really quick. Gary Brown, House District 41. There were a couple of concerns that were voiced to me, and I'd just like to address them. One was if a doctor using off-label prescriptions were to intentionally hurt someone, this bill does not exempt a doctor from malpractice. So if they commit malpractice, this bill doesn't protect them. And then the other thing was the abortion portion of this on the exemptions. There are medications that women use for other things other than abortion that would cause abortion. If the court finds this is constitutional and abortions are medical or chemical abortions are outlawed at that point, the doctor would just simply have to check to see if the woman was pregnant before they use something that would cause an abortion. So that's the simple answers to that. So if you have any questions.
Mr. Chairman.
Thank you very much. Senator Steinmetz, question for the sponsor.
I have one question, and that was on page 4, line 18. We had that language that was a part of an amendment in the other body, and we either needed to add or employment back up after licensing board or take that sentence out in line 18. What are your thoughts on that?
Representative Brown.
Mr. Chairman, Senator Steinmetz, I would be in favor of that if you'd like to amend
Mr. Chairman,
You want to follow up?
Yes, just in favor of what? Which would you, you would be in favor of taking that line out or adding or employment?
I think we would go ahead and take that line out. I think that would be the best thing to do at this point.
Okay, thank you, Mr. Chairman.
Thank you. Further questions, Representative Brown? Further questions? Thank you, Representative Brown. Appreciate it. We'll get Senator Hutchings back, and then we'll, all right.
Mr. Chairman.
Senator Scott.
Mr. Chairman, move the bill.
Motion by Scott.
Mr. Chairman, 2 amendments.
Okay.
First one, page 4, line
This is
18.
small enough bill. We'll just go to where the senator starts. All right. Senator Scott is asking us to look at page 4, line 18.
Delete.
Delete the entire line. Okay. Second part of your motion.
Okay, second part is page 5, line 12 through 22, delete.
All right.
Mr. Chairman, let me explain that.
Please, Senator Scott.
That's taking out the severability clause. We have this is discipline on the drafting. We have a separate severability clause in Title 8 that covers it. We don't need to see them in all the bills, and the way to stop that is take them out when we see them.
Okay. Discussion on the amendment. Discussion on the amendment. The amendment again is page 4, line 18, strike through the entirety, and page 5, lines 12 through 22. Discussion on the amendment. Discussion? Seeing none. All those in favor say aye.
Aye.
Those opposed, no. The amendment is adopted. Are you good with that, Clayton? All right, thank you. Further amendments on the bill. Further amendments on the bill.
Question on the bill.
Further discussion on the bill. Discussion on the bill? All right, seeing none. We are doing a roll call vote on House Bill
164.
Question on the bill.
This is a roll call vote for House Bill 164 as amended. Senator Crum,
No.
Senator Hutchings. Aye. Senator Scott,
Aye.
Senator Steinmetz. Aye. Chairman Barlow.
No.
Mr. Chairman, that is 3 aye and 2 no.
All right, the bill is passed forward. We'll talk about who wants it. You folks be thinking about it. All right, next bill for our consideration is House Bill 135. House Bill 135, a brief reminder of where we were, if you would, Representative, and then we'll start taking public comment.
Thank you, Mr. Chairman and committee members. I believe we kind of left off, there was a proposed amendment from Vitalant, and I just wanted to address that real quick.
Please proceed.
On page 2, line 23, continuing, they wanted to delete, let's see here, unless, they wanted to basically delete the language and say, unless it is not medically advisable and would risk patient harm. I would oppose that suggestion because I believe the language in the bill already addresses it from lines, page 2, line 23 through page 3, line 4. I think it pretty clearly addresses that concern. Also, page 3, line 6, after charge, insert a commensurate and delete not more than. I'm opposed to that. And the reason why is I believe it's Kentucky has already implemented this law and they use a percentage. So I would say if we're going to amend that language of not more than the regular fee, I would suggest not to exceed 15% of their fee. Regular fee is what I would suggest, but I will obviously leave that up to the committee.
Okay,
I believe that's where we left it, so.
thank you. Thank you, Representative. So on Wednesday, Ms. Ray, Ms. McCoy, Mr. Boley, Mr. Pickard, and Dr. Vasilo all gave testimony. Is there anybody in the room who wants to give testimony on House Bill 135? Anybody in the room? Go ahead. Senator Pearson, please.
Thank you, Chairman Barlow, members of the committee. I'm going to wing this testimony, but I would urge your aye vote on this bill. I think that we all know that with the pandemic, there has been a lot of tainted blood with the vaccinations. People want to donate their own blood for those purposes. I can guarantee you that nobody would want my blood, but other than me. But I think that that is the reason for this bill, is that people want to feel secure that they are not getting tainted blood that might affect their health, that could possibly kill them. And I would urge your aye vote on this bill. Thank you.
Thank you. Thank you, Senator. Further public discussion? There is, please come forward. I've got a couple folks online. We're going to start with Clinton Ohlers. I think that is the correct name. Is that close? Start with him, please. Pardon me?
He's ready.
All right, please proceed.
Okay, my name is Clinton Ohlers. I am the vice president and sorry, I'm having a little trouble with the video feed here. Okay, just to start over, I am the vice president of Safe Blood, the U.S. branch, which is in over 55 countries, and I'm executive director of Safe Blood Foundation. I hold my PhD from the University of Pennsylvania with a focus on history of science. And my chief role at Safe Blood is to assess and communicate the science surrounding the dangers of the COVID-19 vaccines for the blood supply and how to protect the public. Safe Blood achieves this by matching non-mRNA vaccinated blood donors with transfusion recipients. We also educate the public on safe alternatives like autologous donations. Now, in cases of emergency, non-mRNA vaccinated donor blood is not available anywhere at this time. Therefore, things like autologous donation beforehand is the only way certain groups like pregnant mothers who may have emergency but don't know that they will can protect themselves and their unborn children should the need of a transfusion arise. What this bill simply does is preserve for the citizens of Wyoming a normal and historically unquestioned medical right, a right that in other states is being denied, not through the process of representative democracy, but by a new hospital and blood bank policies, not in the patient's best interest. It's a right denied specifically because it is assumed but not protected. Therefore, I urge you in Wyoming to protect it. The safest blood a person can receive is their own, and the next is from an appropriate relative. Simple risks such as anemia are easily avoided. Concerns about directed donor feeling pressured or lying is exceedingly small, especially compared with the benefits. Now, patients who request these types of transfusions, they're well informed and their concerns are well grounded. I am currently authoring a peer-reviewed study with Drs. James Thorpe and Stephen Hatfield of the Advanced Biological Research Group and Safe Blood's co-founder, Della Pietra in Switzerland. We're studying multiple cases in the US and internationally of individuals who had not received a COVID-19 vaccine, yet after transfusion experienced injury or death from known adverse reactions to the vaccine. One of the most tragic of these is the well-known case of baby Alex in Washington State, who died from a blood clot that began forming only hours after transfusion, that began at the transfusion site in the knee and ultimately ran all the way to his heart. It was impervious to treatment and eventually killed him. Particularly tragic in the deaths of baby Alex or of 63-year-old Mrs. Esmer in the Netherlands and many others in this country is that these people and parents knew to be concerned. They tried to take simple, effective, and inexpensive precautions, and that right was denied them. In both these cases—
Let's go ahead and wrap it up as quickly, please.
Yeah, I would just say that that the science is here, and when people are denied this right, they're going all over the country. People are going from Minnesota to Florida, from Hawaii to California. They recognize the concerns and they're doing the things that they need to protect themselves. And I think it's very important to see the citizens of Wyoming maintain those freedoms. Thank you.
Thank you very much. Questions? Questions, Mr. Oler? Go ahead.
Thank you, Dr. Oler, Mr. Chairman. We've heard that donating your own blood has serious risks. To me, it seems it would be just the opposite. Can you explain?
Quickly,
Yeah,
please.
that's correct. There is no safer blood than your own blood. I think the risks of anemia that were mentioned on Monday, these are not serious risks. They're negligible risks. They're easily avoided. You can just go to ChatGPT. It's just a matter of timing. There's lots of ways to research that, but they're not serious risks.
Thank you. Further questions? I do have a question. What's the shelf life on blood? I didn't ask this. I wasn't here the other day to ask.
It's
What's the
typically
shelf life?
considered about 40 days, which is enough time for someone to donate to themselves and then replenish.
Thank you very much. Thank you very much. Further questions? All right. Next, I think Dr. Vassallo actually testified on the first day. Yeah. So we're going to just I've got the list of names, so we're not doing any duplication unless somebody has a question. 135. Somebody else has their hand up for 135. Please go. Put your hand up online, please. Have anybody? Go ahead, please, Ms. James. Ms. James, if you can hear us, you should be admitted.
Can you hear me?
Please proceed.
Hello. Hi there. My name is Liz James, and thank you for having me today. I am speaking on behalf of Blessed by His Blood. We are a 100% not-for-profit volunteer cooperative that also matches known donors and recipients throughout the United States. The right to directed donor blood or autologous blood donation is a fundamental aspect of medical freedom and personal liberty. for which every person should inherently have without question, and yet it is becoming harder to accomplish because this right is quietly either being turned off or denied at time of need. The patient is in a very vulnerable place and often do not have the time or physical energy to fight for their right to ensure that their healthcare decisions are carried out as jointly decided upon themselves by themselves and their doctor. People choose directed donation blood for a variety of reasons. Most importantly, all people should have the right to choose what they do or do not introduce. Article 1, Section 38. Each competent adult shall have the right to make his or her own health decisions. I'd also like to bring these points to you. The doctor writing the designated donor order is practicing medicine within his or her scope of practice and is honoring their patient's desire and belief. Both autologous and directed donor blood are legal, safe, and have a decades-long history of prior use. The 14th Amendment of the U.S. Constitution, Section 1, which provides protection of life, liberty, and property and due process of law, is being violated, as is the Wyoming Constitution, as I stated earlier. I'd also like to say that in reference to what is going on, I understand that the blood bank has to go out of state to get their blood, but blood is already made, deliveries are being made on a daily basis already to these hospitals, and so there's no need for a special delivery. And I would also like to state for the record that all blood must be monitored to make sure that, number one, there's no infection, HIV, AIDS, hepatitis, anything like that. All blood is screened for that, not just directed or autologous blood. And with autologous blood, it doesn't matter. And finally, all blood, too, must be monitored to make sure that it is not outdated. That's something that goes on a daily basis. Like Clinton mentioned earlier, it has about a 40-day lifespan.
Thank you.
Thank you, sir.
Thank you very much. Questions? Questions? Just to clarify, Ms. James, I understood that your company matches donors and recipients. Do they also actually do the blood collection?
We do not. We do not.
Okay, thank
And
you.
we have no financial advantage if this bill were to pass.
Thank you.
Thank you.
All right. All right, who else is on 135? All right, Ms. Ham?
Hi,
you're
Chairman
available.
Barlow. Thank you so
Please.
much, committee members, for hearing me. My name is Sierra. I'm a registered nurse from Kentucky, and I'm here representing my business called The Reconciliation. We help people avoid public blood transfusions by promoting prevention and also coordinating care for direct donation. And I wanted to debunk some of the claims about decrease in safety for people who receive direct blood transfusions. Because when you actually look at the research, that is not, you don't see a increase of transmission rates. For one example, there's a study from Dorsey et al. That looked at 4 million transfusions. And they compared direct donor transfusion with people from the general population. And what they found was that the only statistically significant difference was an increase of positive screening for hepatitis C. So if we have a positive screening for something, we don't transfuse that blood. And they're claiming that there's an increase of transmission, but that doesn't bear out. In fact, there's also research that shows that our most vulnerable people, like prematurely born infants who need repetitive blood donation, thrive on and have a decreased risk when they get directed blood donation. So there's a lot of research throughout history, the last 40 years that we've been doing direct blood donation that shows that it is safe, especially considering that we have less than 1 in a million chance of receiving a tainted blood transfusion in the United States, thanks to the very good work of the people of Vitalant and American Red Cross. I also want to suggest that this is an incredible screening process, free screening process being done for people who didn't know that they had hepatitis C to begin with, and that might have given them the early detection that promotes or saves their life and prevents further contamination or spreading of that disease. So
Thank you. Thank
thank
you.
you.
Wrap it up if you got another point.
That's all. Thank you very much.
Thank you. Questions? Questions for Ms. James, or Sierra Ham? Questions? Seeing none? All right. Anyone else online? I don't see any more on the list. Mr. Elliott, please proceed. Mr. Elliott, if you're available, please proceed with your testimony on House Bill 135.
Yes, can you hear me?
Please proceed.
Can you hear me?
Yes, please proceed.
Thank you. Good afternoon, Mr. Chairman and members of the committee. My name is Dr. Cole Elliott, and I'm here to represent the American Red Cross and serve as medical director for Wyoming. I hear you. I respect your concerns. I oppose the bill, but I do not oppose autologous and directed donations. Autologous and directed donations are not against the law currently and are available for healthcare providers to order. The bill is not needed to provide these blood products. As you know, the Red Cross is a humanitarian organization with the mission of helping, and that extends to the blood donor and supply operations as well. We take what the donors give us and help as many people as possible. Something to keep in mind, autologous and directed donations address what is planned medically. However, they do not address what is not planned medically, such as an emergency. Directed donations are not safer than those from the volunteer donor community. Removing the blood center positions can contribute to wastage since a quality control checkpoint is bypassed. Blood products are highly regulated, and each hospital blood bank must do their own due diligence to verify that it is compatible and safe. Directed donations from close family members pose a risk and must be irradiated to prevent graft versus host disease. Hospital blood banks may not be set up to receive and release autologous or directed units, and this could put a strain on your smaller hospitals in particular. Resources wasted could have been allocated for other patients. These units require specific procuring and labeling to ensure they are reserved for a certain recipient. These donations must often be specifically shipped to ensure arrival at the correct hospital in time for a procedure, incurring additional costs. Could the bill lead to price fixing is a concern. I agree with Dr. Basala's previous testimony on all points. In conclusion, I do not oppose these donations, but they are available, and for me, this is not a limited government approach, and I oppose the bill. Thank you for listening and the opportunity to speak respectfully.
Thank you very much, Dr. Elliott. Questions for Dr. Elliott? Questions? Seeing none, thank you very much.
You're welcome.
Anyone else in the room? Anyone else online? Seeing none, we'll close public. I'll give the sponsor, if he'd like to make any closing comments, since we have this kind of split day thing. Any closing comments? All right, thank you very much. Closing public comment committee, what's your pleasure? Motion by Steinmetz. Let's walk through the bill. This is still a white copied bill. I hope you're not going to make it messy. All right, do what you need to. All right, amendments to the bill.
Mr. Chairman, I have an amendment.
Senator Steinmetz.
Excuse me, I'll turn on my microphone. I have an amendment on page 3, line 6. And after not on line 6, to exceed 15%. So it would read, a blood bank may charge not more than, nope, that doesn't work. I want to insert the 15% there. I thought I had it all worked out. And so after then, a blood bank may charge not more than a rate to exceed 15% of their regular fee.
So the insertion is a rate
To exceed not more than 15% of their regular fee.
Second.
Do you have that, Clayton? Think? Close?
And could you repeat one more time where the language is inserted?
Mr. Chairman, Clayton, on line 6 after than, insert a rate not to exceed more than 15%, and then it would say
Of,
of their regular fee.
I think I've got it, you've got it. All right, discussion on the amendment. Discussion on the amendment.
Mr. Chairman,
Senator Crum.
I agree with the direction this amendment's going with 15% because it does cost more to do this. My only question is, when I've talked to the folks in the medical field and in this area, the cost sometimes can be 200 to 300% more because everything's isolated out into separate sections, and then they've got to verify that it's still good. It's not in the normal flow of business, I guess is what I'd say. So the cost is 200 to 300% more. So I do agree with the direction of the 15% more, but I think that number should be in the neighborhood of 200 to 300%. They may charge up to 200 to 300% more because that's what it costs them. And this should not be a loss leader for them.
Okay, further discussion on the amendment. Senator Hutchings.
Mr. Chair, maybe Senator Crum can speak to this. Is the patient paying that cost?
Senator Crum.
Thank you.
My understanding is the patient would pay that cost. They're the one making the recommendation to use it, so they would be the one that would pay that cost. Or the facility, through the facility, pay the cost. Yes, ma'am.
Further discussion.
Thank you, Mr. Chairman.
Thank you. Further discussion on the amendment? Further discussion, seeing none. All those in favor of the amendment, say aye. Aye. Those opposed, no.
No.
So the amendment has failed. The chair voted no as well. All right, further amendments in the bill.
Mr. Chairman,
Senator Crum.
I would, same thing, but I would change the number to 300%.
All right, all the same verbiage except the percentage is different, 300%. Discussion on the amendment. Discussion on the amendment. Seeing none. All those in favor, please say aye.
Aye.
Aye. Those opposed, no.
No.
That one has failed. We're not going to resolve that. The chair voted no. Further discussion or further amendments on the bill. Senator Scott.
I speak against the bill.
Okay, further amendments before we take up the bill?
Well, Mr. Chairman, then maybe we should look at a fee commensurate to their actual expenses.
So there's
I
a
would
motion
make that
to
motion.
may charge not more than a reasonable fee.
A reasonable fee commensurate to their actual expenses.
May charge a reasonable fee, not more than their actual expenses?
Yes, Mr. Chairman.
All right, we'll, if this passes, we'll make sure it's correct for the, all right, discussion on that amendment? Discussion on that amendment? All those in favor say aye.
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 Those opposed, no. All right, that amendment has been adopted. All right, we will verify that language before you leave, Senator, please. Further amendments to the bill, further amendments to the bill. Discussion on the bill before we vote. Senator Scott.
Mr. Chairman, I think the bill's headed in the right direction. I think this is one of those things that's going to require several tries at it to get it all the way right. So I think the bill's done quite a service. It's brought the issue to us, but I don't think it is ready for prime time yet. I can't figure out what part of the opposition to this is just bureaucratic bloody-mindedness on the part of, no pun intended, but just bureaucratic obstruction on the part of the existing blood provider and some of the larger hospitals maybe. And I'm not sure what's within the capability of our hospitals and what isn't reasonably. And I think on the fee, we really probably need to nail that whole one down better than we have even with the amendment. So I think this is not quite ready for prime time, and more work is needed. Another year perhaps, Mr. Chairman. But I do, well, I oppose this version of the bill at this time, I think it's doing us a service and it's started us down a path we need to go down.
Thank you very much. Any further discussion? Senator Hutchings. on
Thank
the
you,
bill.
Mr. Chairman. I appreciate that. House Bill 135, I think, was written well. I look at it and we're codifying a practice that's going on and letting people know what should be expected of them. I think it's drafted well. I have no problem with it, and I'm on and for it. Thank you, Mr. Chairman.
Further discussion?
Mr. Chairman.
Senator Crum and Senator Steinmetz. Everybody's going to visit.
Okay. It's kind of like a auction, isn't it, where we're going to buy some cattle here today. My question is, I actually donated blood to myself. I had knee surgery and donated blood to myself. Thank goodness we didn't need to use it, but I guess I'm not seeing the reason for the bill, because we're already doing that type of stuff. Just a question or a comment or open for, discussion on that, Mr. Chairman.
There's no discussion. That's your comment. Senator Steinmetz.
Thank you, Mr. Chairman. On and for the bill, and I'm glad to work on crafting that amendment a little better on committee of the whole if we need to. But I think this is a bill that citizens across our state really want to have in place, and on and for the bill.
Mr. Chair?
Senator Hutchings.
Thank you, Mr. Chair. To answer Senator Crum's question, with, I think the increased sexual activity in our day, like we said, the pandemic, with people getting the vaccination, with medicines that people are taking, you really don't know what's in the public blood, but you know what you've put in your body, and prayerfully you know what your family or friends have put in their body. So that's why I think this bill is needed, just to make sure you're gonna get something that you know is gonna be good blood. Thank you.
Thank you. Further discussion? I guess the thing that I guess gives me pause is on the bottom of page 2 and the top of page 3, and it's the contraindications. It first says you have a prescription, and then it says unless. The unless actually should be part of the prescription portion, but whoever's ordering it should know those things to begin with. But then it's a little ambiguous to me who has to actually make that second determination about ill health, heart condition, et cetera. So that gives me some pause. I know there was some language suggested. It was not, the sponsor didn't think that was necessary. So, all right, we're going to take a vote on
Just
House
quickly,
Bill
Mr. Chair?
135. Senator Hutchings.
Just quickly, we've heard testimony saying numerous times that the blood is tested, and somewhere in my notes, so it's not like it's monitored. So they will know, I guess, the people who are pulling the blood out and doing the monitoring, whether this blood is gonna be good for the patient, if that answers your question. Thank you.
It does not, but thank you anyway. Thank you. House Bill 135, autologous and direct blood donations, roll call.
This is a roll call vote for House Bill 135 as amended. Senator Crum?
No.
Senator Hutchings? Senator Scott?
No.
Senator Steinmetz?
Aye.
Chairman Barlow?
No.
Mr. Chairman, that is 2 aye and 3 no.
Thank you very much. Well done. All right, next bill up for us is House Bill 96. House Bill 96, the sponsor gave his opening comments, and I will take public testimony. I see Ms. Ward here, welcome, and you may proceed with your comments.
Thank you very much, Chairman Barlow. I wanted to clear up 2 questions that were asked during the testimony of this bill. The first is whether this applies to operating rooms and industrial hygiene. It does not. It is only for COVID mitigation. The bill only applies to wearing a mask, getting tested, or getting vaccinated for COVID-19 and all its variants. So folks are still allowed to wear appropriate PPE in the OR, in industrial hygiene settings, and so on. Secondly, I wanted to clear up a question on page 3, lines 6 and 7. It says, no person who receives subsidies from the state or federal government shall. The reason for that language is so that businesses cannot claim they are private businesses and we can't tell them what to do. If you receive state and federal subsidies, you are by definition not a private business. With that, I'd like to explain just quickly why I support this bill. The bill eliminates discrimination for not wearing a mask, not receiving a so-called vaccine, or not getting tested. The bill protects individual liberty by requiring that all persons, i.e. businesses, organizations, public and private, who receive any kind of taxpayer subsidy, not discriminate against those who refuse to wear a mask, receive a vaccine, or so-called vaccine, or get tested. And before I continue, I forgot to say my name. I'm Jeanette Ward, and I'm speaking on behalf of myself. A few summers ago, one of my daughters needed a sports physical in Casper. We needed it quickly, so we stopped in the community health center. We were turned away at the door because we refused to wear a mask. I couldn't believe this was still a thing in 2022 in Wyoming. Then last year, my daughter, who was in a nursing program at college at the time, was required to get a COVID test to continue her nursing program. In 2024 in Wyoming, how is this still a thing? My daughter has since left the nursing program. To those lobbyists and agencies who come before this committee to bemoan the fact that they can't get healthcare workers, this is why.
Thank you. Thank you.
I'm not
Questions?
quite done. The bill prioritizes.
You are done with, because 2 minutes.
Okay, I'm
I've got
sorry.
the timer.
Great, thank you,
So-
sir.
But I'll allow some questions. Maybe you'll get
Perfect.
to fit it in there. Senator Scott had a question.
Yes, Mr. Chairman, page 3, line 6, the word subsidies. This question either for Swart or for the sponsor, is reimbursement by the state for Medicaid. Is that a subsidy or is that a payment for services and not a subsidy?
Ms. Ward, if you'd like to.
Thank you, Mr. Chairman. Yes, that would be a subsidy or payment by the state. Any funds received from the state or federal government in the terms, in sense of entitlement, is a subsidy.
Thank you. Senator Steinmetz has a question.
Thank you, Mr. Chairman, and my question deals with the same line, because I was wondering if we needed to insert an appropriation or subsidy from the state or federal government, and we could say appropriations or subsidies, because I know that if you're dealing with a governmental entity, it would be more of an appropriation than a subsidy.
If you'd like to comment.
Thank you, Chairman Barlow. Yes, I would consider that a friendly amendment. Speaking as myself, I'm also open to comments by the bill sponsor.
Thank you.
Thank
Further
you.
questions? Yes, Senator Hutchings?
Thank you, Mr. Chair. So if I get the bill right, your major concern is testing, masking, and vaccination requirements for the COVID virus and any variant which may or may not come up at any time in the future.
Go ahead, please.
Thank you, Chairman Barlow. Yes, Senator Hutchings, that is correct.
Okay, thank you. Further discussion, further questions?
Mr. Chairman,
Senator Crum?
just a quick question. So if I understand things right, payments from Medicare, Medicaid are considered subsidies,
If you'd like to respond.
Mr. Chairman.
Thank you, Chairman Barlow, and yes, Senator Crum, that is correct.
Thank you, Mr. Chairman.
Thank you. Thank you very much. Appreciate it. Who else wants to testify to this bill? 2 people. Let's go ahead and fill chairs, please. I've got folks online. I've got a timer going here. Mr. Winnie, we're starting with you, and we're going to go down the line. Anyone else that wants to be close by? Go ahead, Mr. Winnie.
Mr. Chairman, Bill Winnie, Sublette County. A few years ago, at the height of the COVID scare, I guess I'd call it, I found myself advised by my primary care physician that he did not like what he saw in the data, and he therefore recommended I not get the inoculation or vaccine. And so I didn't. Then there's a second point. People frequently hold up the military as an example. You know, when you first come in, you go down the line there and they've got these people with these air guns that inject you, and you get like 10 or 15 or 20, I think it's like that, but a bunch of vaccines all at once. I still got a hole in my arm over here from where they had a gun set a little bit too high. But at the end of the day, the point of this bill is very simply, there was a lot of push and shove on doing things when in fact, the science behind the vaccines administered to the military was generally accepted as effective. The COVID vaccine at that point in time was not. It was still labeled experimental. Subject to your questions, thank you, Mr. Chairman.
Thank you. Questions for Mr. Winnie? Questions? Seeing none, thank you very much. Please proceed. Introduce yourself.
Thank you, Mr. Chair. My name is Dr. Ben Moritz. I'm the Executive Director of the Community College Commission. I am wanting to call out some perhaps unintended consequences of the bill. As you may know, and I think as was previously spoken to, the colleges offer healthcare programs. In those healthcare programs, there are clinical requirements where the students have to go out in the field and work in the healthcare profession. In those areas, they're frequently around high-risk populations. They could be in hospices, they could be in different areas such as that. When that occurs, they are frequently asked by the provider, actually required by the clinical provider itself, to wear a mask to prevent the spread of disease. It could be COVID, it could be other diseases. COVID really triggered that and raised that bar. If the colleges are not able to make those requirements on behalf of their clinical providers, or as I believe Romanet 2 speaks to even publishing those kinds of requirements, they would perhaps be unable to continue to train those healthcare workers in the way that is required by the medical profession. So I wanted to call that to your attention, and I would stand for any questions.
Thank you very much, Dr. Moritz. Any questions for the Community College Commission Executive Director? Was that the right term? Thank you. Questions? Senator Hutchings.
Thank you, Mr. Chair. You know, when I read the bill, Dr. Morris, I don't see in here the concerns that you have. This was mainly for COVID and or its variants, and then it's talking about refusing people in facilities, so on and so forth, but I don't see it mentioning the community colleges at all. Maybe I'm wrong, but I just don't see where you're.
I'll just give you the reference that
Thank
Dr.
you.
Moritz
Thank
gave us,
you.
page 3, line 18, any communication notice regarding the requirement to mask. And I think that's what he was referring to, line 18, any communication notice, et cetera. All right? Further questions? Thank you very much. Please proceed. Mr. Bowley.
Mr. Chairman, committee members, Eric Bowley with the Wyoming Hospital Association, and I also represent long-term care facilities in our state. Before I start my testimony, I just want to share with you, 3 years ago yesterday, while I was sitting here fighting with the legislature over this exact same thing, my father-in-law died from what some people are calling a scam, or the scamdemic. He breathed his last breath 3 years ago today while my wife sat with him. So this is a real thing. As far as my testimony is concerned, we're opposed to this for many different reasons, but I think the most important one is that we are still dealing with the same things, and I think this is absolutely unnecessary. I shared with all of you a couple of handouts, and my concern right now isn't really with hospitals. As far as masking, vaccines, and immunizations, they're not required anymore. We were forced by the federal government to put mandates in place during the pandemic, but at this time those have been lifted. However, in long-term care, we're still required to mask our patients and to isolate patients that have COVID. And one case in a nursing home is considered an outbreak. Right now, we only have one nursing home that's an outbreak, but 2.5 weeks ago, when we were in the middle of this in the House, we had 6 of our nursing homes that were an outbreak. The nurses that care for those patients are required to mask. And the way that I understand this bill, and every one of our hospitals and nursing homes are going to be affected by that subsection B. They all receive Medicare and Medicaid. And this bill is specifically targeted at them, I believe. With that said, though, the way this is written, if we require nurses to wear masks to care for a COVID positive patient, we're basically saying that if they're not happy about that, we may as well open our checkbook and write them a check for $5,000 every single time they're upset, because that's the penalty that's in here. You're asking us to serve two masters. We're either going to have to adhere to the state law, or we're gonna have to adhere to the federal law. And right now, the federal law requires us to do this, and if we don't, they can shut down our funding, they can shut us down for admissions, and we'll lose our federal funding. So if you're going to pass this, and this is what I suggested in the House, then I would ask you to appropriate the money to defend us and to make up for any lost revenue that we have, and to take care of the lawsuits that are going to come to defend this $5,000 per occurrence. I'm going to use this, your own words though. On Monday, we talked about the off-label use of drugs, and you talked about what about the next pandemic. There's a good chance it's going to happen. So do we want to set a precedent right now, and we're going to legislate how we care for patients? You'll hear from healthcare providers in this room that masks don't work. N95s are made specifically for viral infection. And for years, we've required our providers to wear surgical masks when they take care of patients in the surgery.
Wrap it up, please, Mr. Boley.
So we need to let science, we need to let best practices guide us. And I would ask you to oppose this so that we don't put our nursing homes in jeopardy this time. With that, I'd answer any questions.
Thank you. Senator Crum for Mr. Boley.
Mr. Chairman, my question would be, if I heard things correctly, if you don't follow the rules, a mask sometimes, the federal government says you mask, then you won't get your payments from Medicare or Medicaid. Is that what I heard?
Mr. Boley.
Mr. Chairman, Senator Crum, that's the threat, and that's what was used to implement the mandates during the pandemic, and that we're still faced with.
Thank you, Mr. Chairman.
Further questions? Further questions for Mr. Boley? Anybody else that wants to, there's going to be empty chairs. Go ahead, next.
Thank you, Mr. Chairman. My name is Chris Mickey on behalf of the Wyoming Business Alliance. We have some serious concerns with this bill. As Mr. Boley just stated, we represent some of the same members that he does, as well as businesses such as airports who also receive federal subsidies, but are also directed by the federal government to do things like mask at their institutions. So when you have that direct conflict between the state and the federal government on what you can do and can't do, that is where we see a serious issue with this piece of legislation. So there was an amendment that came over in the House that would provide some reimbursement if the business complied with the state statute rather than the federal government, and we would support that. That if this body chose to take that policy stance, that we put some skin in the game from the state of Wyoming and reimburse these folks who are being punished from the federal government by enacting these policies. So that I stand for any questions.
Any questions? Questions, please proceed.
Mr. Chairman, my question would be, if the federal government didn't pay and then you're for the amendment of the state paying, how much money is that we're talking about that the state would pay if it lost the federal funds?
Please proceed, if you have an estimate.
Mr. Chairman, Senator Crum, I don't have any solid answers for you, but some folks who work at these specific businesses could probably give you a little bit better answers on that.
Thank you. Further questions? All right, Senator Steinmetz.
Thank you, Mr. Chairman. I'll try to be brief. We have had a change in administration since all of this happened. So, I mean, the fact that it's hard for me to believe that the administration we have now would enforce all of these mandates. Do you have an answer for that?
Any thoughts you'd like to offer?
Mr. Chairman, Senator Steinmetz, certainly that's a consideration I think we are all facing right now. And while that may be the case, in 4 years after this, is that going to be in effect still, or are these going to get reimposed should they be taken away? So that's something we've been thinking about as well, and certainly that would be great if these were taken off of the plate, but that's never finite, and so.
Okay, thank you. Senator Hutchings, you had your hand close to the mic? No? All right, further discussion? All right, go next. Anybody else who wants to testify, come on up. And then we're going to go online.
Mr. Chairman, I'm Jan Cartwright, representing the Wyoming Public Health Association. The WPHA is opposed to this bill, which removes the ability of health officials at the state and county level to protect all populations during once-in-a-lifetime infections. This proposal targets the very buildings where many people have to frequent, like city-county buildings. This bill loosens protections for many workers who cannot simply work from home and who may not even have health insurance through their work to help them if they do become sick. from exposure to highly infectious agents. Thank you, Mr. Chairman.
Thank you very much. Any questions? Any questions? Thank you very much. Appreciate you. Senator Pearson.
Thank you, Chairman Barlow, members of the committee. Laura Pearson, Senate District 14. I would ask that you support this bill. Even though the pandemic is over for now, we must protect our citizens from any further overreach. People lost their jobs if they didn't comply. The mandated masks and education caused multiple issues for children, including learning and even brain damage. And it's pretty clear that 90% of the masks didn't help. It was a feel-good measure. Those that did comply are experiencing adverse reactions, and many have lost their lives. Once again, we must protect Wyoming citizens. They are asking our leaders to do the right thing, protect their livelihoods, their children, their lives. We must protect the people, not the agencies. We are the voice of the people. Is the money more important than our lives? That's a question that I have for you.
Thank you. Questions for Senator Pearson? Questions? Seeing none, thank you very much. Anyone else in the room? Anyone else in the room? Going online, I have Kelly Carpenter.
Only Dean Bartholomew is on.
All right.
He's for the
Dr.
next bill.
Bartholomew, welcome.
He is for the next bill.
Oh, he's for the next one. All right. Only one, then Kelly Carpenter is not available? All right. Let's have the sponsor come back if he'd like to make any closing comments to the committee, and then committee will take up your bill.
Thank you, Mr.
Please.
Chairman. Just a few comments. First of all, bill does not prevent individuals from choosing to wear masks, get vaccinated, or undergo testing. It simply ensures that these choices are voluntary, not coerced, which promotes personal responsibility and informed decision-making. We'll go back to a couple of bullet statements I made before, just to repeat those. The bill ensures that individuals are not discriminated against based on their personal health choices, such as vaccination status or mask wearing preferences. Promotion of personal freedom. It upholds the principle of personal freedom by allowing individuals to make their own decisions without fear of losing access to public services or goods. Does provide some legal recourse. Reduction of government overreach. And finally, I'd just like to say that to some of the speakers' comments as far as reimbursement up to this point, no, they're not enforcing these laws at this point. I also like to repeat that the Senate and House leadership are going to be going to DC after this session. And I will certainly be in our speaker's ear to talk to the Department of Health to get that rescinded so we can just not worry about that. And I stand for questions.
Thank you. Questions for the sponsor? Senator Crum.
Mr. Chairman, just one quick question. In the bill on page 3, and then it goes through a whole bunch of things here, but basically it says no person who receives a subsidy from the state or federal government shall, and then it goes into a list of things. My question, would that apply, say, to schools who get funded to the state, who then go to McDonald's with an orchestra that we saw here the other day, and they use a school voucher to pay at McDonald's? Can McDonald's, a private business, then refuse them or not refuse them since they're receiving this money from the state?
McDonald's
I know
refuse them?
I know
That
that's
was-
a long thing, but yes, go ahead.
The McDonald's is a private business that I know of, so no, they couldn't enforce it.
Thank you,
Okay.
Mr. Chairman.
Further questions? Senator Hutchings.
Thank you, Mr. Chair. I'm trying to wrap my arms around everything too, and I see that section B is, on page 3, is an issue. But the way I'm seeing this is, and I think this is the intent, and if I'm wrong, you can tell me I'm wrong, that, let's just say, I am a nurse and I'm working in a hospital. generally, you're gonna follow the rules and you're gonna wear your mask because you wanna keep your job, but we're saying that you can't force a person to do that. And it looks like on lines 10, you're saying, okay, if I refuse to wear my mask, you can't deny me any services, goods, facilities, advantages or privileges that are public in nature and that invite the patronage of the public based on a person's COVID-19 status. So it's kind of like, it seems to me, is that this is a public institution, you're inviting me to come in, but you want people to wear masks, but I can choose not to. Is that correct?
Go ahead, Representative.
Thank you, Mr. Chair. Correct.
So, further question, so I have a follow-up on that. So this would not apply to the employee of that very same institution? I always want to be clear, because public in nature, and you asked about an employee, so does this apply to employees, going back to some of the testimony? The way you understand this is written, does it apply to an employee at a health facility?
If that facility receives funds from the government entity, yes.
Okay, did that clarify it for you, Senator Hutchings? All right, thank you. Further discussions?
Mr. Chairman?
Senator Crum.
I'm just sitting here wrestling, so it's public, okay, I get that. Then I'm sitting here wrestling that we got private, McDonald's, I probably should, a hamburger stand. That's private, so they're exempt. So then what about like our largest healthcare provider in the state, which is located in the good Senator Scott's community, which is a private facility? Are they exempt or not exempt from this? Because it's a private business.
Go ahead, please, Representative.
If it's a private business and they do not receive funds from state or federal coffers, then they can choose, they have the ability to choose their own rules as it's written.
So the answer would be no. If they receive Medicare or Medicaid payments, that would, at least based on the testimony so far, they would not be able to do that.
Thank you, Mr. Chairman, thank you.
Anything else for the sponsor? Any final comments? Oh, Senator Hutchings, then Senator Steinmetz.
Thank you, Mr. Chair. So why did you single out them, if you don't mind, the state and federal governments? Why are they kind of like, okay, it's you?
Go ahead, Representative.
It's not just governments, it's any entity, okay? We left it that way because we shouldn't be able to tell private business what they want to do. If it's a private business and they say, I want you to wear a mask, then you either wear a mask or don't go in.
Thank you, Senator Steinmetz.
Thank you, Mr. Chairman, and I guess I see it a little broader than that because of the publish, display, mail, either directly or indirectly, or any communication, notice, or advertisement that states a person is required to wear a face covering for, the whole paragraph there at the bottom of line 3. I would think that would keep the Department of Health from telling private businesses that they have to do all of these things to comply. Am I reading that correctly?
Representative?
It's a protection, excuse me,
No, sorry.
Mr. Chairman, for a private business there.
Please proceed.
Thank you, Mr. Chair. Yes, ma'am.
Okay. Further discussion, further questions for the representative? Further questions? Seeing none, thank you very much. All right, committee, what's your pleasure? What's your pleasure on the bill? This is House Bill 96.
I'll move it for discussion.
Moved by Steinmetz. Discussion on the bill amendments, page 1, page 2, page 3, page 4. Seeing none, discussion on the bill. Senator
Mr. Chairman, on and against the bill.
Scott.
This, frankly, I think is an overreach and sets a bad precedent. A good part of the reason, we're dealing with an infectious disease here, and a good part of the reason for the restrictions is to protect third parties from catching the disease that somebody might have, that where it could be prevented from being spread by a vaccine or particularly by, in that case, by a mask. And I think the hospitals have got an obligation to protect people that are vulnerable, that are in their care, from somebody who might be spreading the disease. And that's what some of these restrictions are designed to do. So, Mr. Chairman, I think it sets a bad precedent that way, and one that might get us in trouble directly if we have a recurrence of COVID on a much more virulent strain, which hopefully won't happen, Mr. Chairman, but very well could. So I also think that it's not as well written, because I think with that subsidy language, the bureaucracy would instantly interpret it that it doesn't apply to anybody that gets Medicaid. They aren't getting subsidized. So, Mr. Chairman, the bill doesn't work.
Thank you, Senator Scott. Further discussion on the bill? Further discussion? Senator Steinmetz.
Thank you, Mr. Chairman, and I'd be glad to work with the good sponsor of the bill to look at some amendments on committee of the whole. Should it pass out of here, I think we could tweak it a little and make it a little more concise. Thank you, Mr. Chairman.
Thank you. Further discussion on the bill? Further discussion? Seeing none? All right. So I am not going to be in favor of this bill, not because I don't understand the concern, because I'm concerned about no person, which is everybody, everything, every entity, period, by statutory construction, it's everything. And then I've made this comment to several folks who asked me about it, and I said, subsidy, if we want to understand what that is, we should have had a definition. And I don't know what the definition should be, but I don't consider personally Medicare or Medicaid a subsidy. I consider that a fee for service or a provision. The state of Wyoming, I know of one subsidy that we have actually given out, and that was for hospitals in about 2015 or 16. Senator Scott will remember, he can remember probably 3 others in the past. So subsidy is something different. I'm in the agriculture industry. I understand what subsidies are in my world, but I don't understand what it is in the context of this bill and what the breadth could be. I'd also point out that if you received an ECA or an ESA and went to a private school, then that private school would not be able to do these things potentially, depending on what you believe a subsidy is. So I just throw those things out. I'm not disparaging the intent or of the bill. I just don't know how broad it actually applies with what we have before us. So further discussion? Further discussion? We'll take a roll call vote on House Bill 96 to do pass motion prohibiting mask, vaccine, and testing discrimination. Please.
Senator Crum?
No.
Senator Hutchings? Senator Scott?
No.
Senator Steinmetz?
Aye.
Chairman Barlow?
No.
Mr.
Thank you
Chairman,
very
that is
much,
2 ayes,
Representative.
3 no.
You did have a senator who said even though it's not going to committee of the whole, if you'd like to continue to work on this issue, you have folks who'd be interested in assisting. Thank you. All right, next bill up for our consideration. Is the sponsor here? Sponsor's not here. Chief Walmsley, are you going to present this bill? You are now.
Thank you, Mr.
All right,
Chairman.
next bill for consideration is House Bill 136. The member was in another meeting and he was going to try to get here on time, depending on how fast we move. So Chief Walmsley knows this issue and this bill well. Go ahead, please, Chief. Introduce yourself to the committee.
Mr. Chairman, members of the committee, I'm Jim Walmsley. I'm the Fire Chief for the City of Rock Springs Fire Department. I'm here on behalf of the Wyoming Fire Chiefs Association. I'm here to speak in favor of this bill. In the last legislative session, the bill was passed that enabled volunteer firefighters to participate in the state health insurance pool. One of the unforeseen conflicts that came out of that was that the Affordable Care Act language interferes with the ability of those same volunteer firefighters to access the benefits of this bill. So what this bill does is correct that misalignment in language. So I'm here to ask for a favorable review of this bill and for your support. I'll stand for any questions.
Questions for Chief Walmsley? Questions for Chief Walmsley? I think probably for the committee, I'll just walk through the bill very quickly. And the bill really gets started. This is, as the chief said, language or a bill from legislation from last year. Page 3, this is where that exclusion is. It says that doesn't count toward the eligibility. And then you go down to the next subsection, which is 6 through 18 on page 3. This is about, submitting their monthly premiums. And then a little further down, just make sure that it's the cost can be shared by the service if they so choose to. And then the bottom of page 3, this monthly verification, their proposal is to change that to an annual, so it's not so much paperwork and bureaucracy. And that is the bill. Questions for Chief Walmsley? Nope. Thank you, Chief. Anyone else want to testify on this bill? Anyone online? None online on this bill. All right. Andrew Byron, Representative Byron isn't going to make it, but that's okay. We can handle this. What's
Move the bill.
There's a motion by Scott. Move the bill.
Mr. Chairman,
Senator Scott.
this is needed to give the people that run these so-called volunteer organizations an additional recruiting tool. Those that are providing vital services. This is very much needed. The exclusion from the marketplace under the Obamacare is needed, and I can explain that if anybody wants me to, but it would take too long. So, Mr. Chairman, on and for the bill.
Further discussion on the bill. Further discussion. I have one for the committee. I would argue that we should make it effective immediately. And that's only 3 months difference maybe, but I don't know that it changes anything. There's nothing in the bill that looks like it would be harmed by that. So I've moved to have it effective immediately. Discussion on that? All those in favor of the motion to standard language for effective immediately on page 4, line 5. All those in favor say aye. Aye. Those opposed, no. Motion is adopted. Further discussion on the bill? Further discussion? Please call the roll on House Bill 136.
This is a roll call vote for House Bill 136 as amended.
Aye.
Representative Crum, or Senator Crum.
Aye.
Senator Hutchings.
Aye.
Senator Scott.
Aye.
Senator Simons.
Aye.
Chairman Barlow.
Aye.
Mr. Chairman, that is 5 ayes.
Thank you very much.
Mr. Chairman,
Yes, Senator Hutchings.
I'd like to say congratulations, Chief Wamsley. You passed your first bill out of committee.
Chief Walmsley is also the board chairman for the State Emergency Response Commission, besides being the chief in Sweetwater County. So he wears many hats, and we appreciate the work he does. All right, we have another bill before us. We have a half an hour. We're going to be hopefully just as disciplined as we have been on the first 4. And unless somebody needs a break, we're going to keep going. All right, next bill up for our consideration is House Bill 222. Is Representative Ottman here? Okay. You're welcome to text her or tell her. We'll stand at ease until she confirms she can make it or not. How's that? Thank you. Looks like everybody's interested in this next bill too. Three people online for this one still? Representative, I'm sorry, Chief Walmsley took care of your business. The bill has been passed, and we thank you for your attentiveness to the Senate committee. Thank you, appreciate it. You have 2 online? Dr. Bartholomew and who? Okay. Okay, Alliance, okay, perfect. And how many people want to speak to this bill in the room? I have agencies, several agencies. Okay, 8 people, 9 people? I couldn't see behind the post, so if you're behind a post, I might not have counted you. Well, I won't exclude you, but I may not have counted you. We'll be patient. We got a half an hour. And we never start on time anyway. That's true. Out there. Is it? Oh, we might have Bill sign.
Yeah.
Thank you very much. We have a courier service here, and they couried the good Representative Ottman here. Welcome. Take a moment to gather your breath, collect yourselves if you need to.
Thank
And
you,
then
Ms.
we'd love to hear a presentation on House Bill 222, Medical Ethics Defense Act 2.
Thank you, Mr. Chairman and committee. I'm just glad you weren't in the Hirschler building. Yes, okay. Pepper Ottman, representative for House District 34.
Would you pull that microphone a little closer? This room
Yes.
isn't great.
Is that better?
Yes, thank you very much.
Okay, today, wait, I'm still huffing and puffing.
Take your time. Take your time.
First off, I just want to say thank you for giving this bill a committee hearing, and I really appreciate that because it's been something that when you were Speaker of the House that I brought, and so it's just getting better and better. So, okay, House Bill 222, Medical Ethics Defense Act. And what I will say, one of the things that sparked this was there was a survey of medical professionals, and 73% of the people that were surveyed in this profession said that they would stop practicing medicine apart from conscience protections. And this survey was a few years ago, and we can see the decline in the population of medical professionals and what's going on. 92% would care for all patients regardless of agreement with the patient's choices. So there's people out there in our communities that want to be working, that want to fill these positions that we so desperately need. But as we are looking at CTE and employment and things like that. And we're looking like today we had a bill about international health care and how important we're looking for people all over to fill these slots. This is just one more tool to help us get people back. So I can't believe I'm still.
You're welcome to take your time, but I think if you would, just walk us through the bill.
Okay.
We'll go to public testimony. I'm limiting public testimony to 2 minutes.
Okay.
I want to hear your bill, I want to see it through, but we've got a limited amount of time, so.
Okay. House Bill 222, also known as the Medical Ethics Defense Act, is designed to protect the rights of healthcare professionals, institutions, and payers in Wyoming to refuse participation in or payment for healthcare services that conflict with their ethical, moral, or religious beliefs. The bill ensures that these individuals and organizations cannot be coerced into providing or paying for services that violate their conscience, and it establishes legal protections to prevent discrimination or adverse consequences for exercising this right. The key provisions are rights of conscience. And what that means is the bill establishes that healthcare professionals, institutions, and payers have the right not to participate in or pay for healthcare services that conflict with their conscience. The term conscience is defined as ethical, moral, or religious beliefs. And for healthcare institutions and payers, it includes the guidelines and principles set forth in their governing documents, such as their mission statements and bylaws. The right to exercise conscience is limited to specific healthcare services, and it does not alter the obligation to provide or pay for services that do not violate the individual or organization's conscience. It also does not affect the duty to provide emergency medical treatment as outlined in federal law 42 U.S.C. 1395 DD. The discrimination protections. The bill prohibits discrimination against any healthcare professional, institution, or payer who chooses to exercise their right of conscience. This includes protections against negative actions from employers, the state, or other entities based on their decision not to provide or pay for healthcare services that violate their beliefs. Additionally, individuals and institutions are protected from discrimination if they report violations of the Act or assist in legal proceedings related to it. The bill further prohibits discrimination against healthcare professionals for disclosing information regarding violations of federal or state laws, professional standards, or unsafe practices that may jeopardize patient health or safety. In the portion of immunity from liability, healthcare professionals, institutions, and payers who refuse to participate in or pay for healthcare services that violate their conscience are granted immunity from civil or criminal liability. This immunity extends to healthcare institutions for the actions of their employees or contracted professionals who exercise their conscience rights. The civil remedies and enforcement. The bill provides a mechanism for individuals or institutions who believe their rights under the Act have been violated to seek civil remedies, including damages or injunction relief through a court or competent jurisdiction. This provision ensures that those affected by violations of their conscience rights can pursue legal action to remedy the situation. The notice requirements are very important. Healthcare professionals must be notified within 14 days if their license, certification, or registration is at risk due to their exercise of conscience rights. If the Department of Health or relevant licensing agency fails to provide timely notice, they will be liable for damages of $500 for each week the notice is delayed. However, this provision does not apply if notice is required to be given within a shorter period under other laws. Implementation and applicability. The bill will apply to healthcare services and payment obligations that arise on or after July 1st, 2025. It specifically exempts any law in Wyoming that is more protective of conscience rights than this act. The bill also mandates that the Wyoming Department of Insurance and the Department of Health issue the necessary rules and regulations to implement. The Medical Ethics Defense Act 2 provides significant protections for healthcare professionals, institutions, and payers who choose not to participate in or pay for healthcare services that conflict with their moral, ethical, or religious beliefs by prohibiting discrimination, providing immunity from liability, and offering legal avenues for enforcement. The bill seeks to safeguard the conscience rights of healthcare providers in Wyoming. The act is set to go into effect July 1st, 2025, and will be enforced through the creation of relevant rules. The bill, beginning on page 2.
Representative, I don't know if you
Yes.
need to go through the bill line by line. Your overview kind of touched it. We were able to walk through the bill as you did that.
Okay.
If you think there's something very specific you want to point out, please do so, and then we're going to go to public comment.
Okay, what I will say is, the bill protects the conscience rights of the medical professions, and what it is that people, it does protect, I mean, the right to do, or the medical ethical thing of do no harm. The medical profession is very, very aware of that, and people that go into this profession would not do that. As I said earlier, things are in their bylaws of what they believe and what they'll do. So those things are protected. It basically is to enable people that have these views to be able to perform the way that they want to, just like everybody else does. And it's just for those protections, but also to identify a business or practice that they may want to do. It doesn't inhibit anything in an emergency room or anything like that. All of those protections are covered by law and are worked out. So if there's any question, or you wanted public comment?
Thank you very much. Any questions for Representative Ottman? Questions for Representative Ottman? Senator Hutchings.
Thank you, Mr. Chair.
We have 20 minutes left.
Representative Ottman, quickly, how many states are have put this law into effect, if you can tell me?
Representative Ottman?
Mr. Chairman and Senator Hutchings, I believe 22.
Thank you.
Further questions for Representative Ottman? Further questions? Seeing none, thank you very much. Stand by. State agencies, licensing boards, come on up, fill the chairs. Those that want to come up next, be on the edge of your seats, please. Go ahead, Director. Department of Health Director. Sorry, there's probably more than one director up there. Go
Mr.
ahead.
Chairman, thank you. Stephen Johansson with the Wyoming Department of Health. I'll be very brief, more of a technical comment for the committee and the good sponsors awareness. She mentioned the rulemaking authority to the Department of Health and the Department of Insurance on page 12. We do not have rulemaking authority or authority, licensure, et cetera, over specific healthcare practitioners or the practice of medicine. So Board of Medicine, Board of Nursing, Board of Psychology, Mental Health Practitioners Board, et cetera. I think that would be problematic for the Department of Health to promulgate those rules without authority given to the relevant licensing boards who regulate the practitioners directly. So just more of a technical comment on where the rule authority should be, Mr. Chairman, but I'll defer certainly to my colleagues here who represent some of those various entities. With that, Mr. Chairman, happy to I'll actually mention before that, in our undying commitment to this body, we're happy to coordinate with various state agencies. The legislature through bills has directed that before, but just wanted it to be clear that the Department of Health and virtually all of the healthcare professionals that are mentioned on page 4, we do not have direct regulatory authority over them. Our regulatory authority is generally over healthcare facilities, mostly on the construction, life safety, and certain types of the healthcare service delivery. With that, Mr. Chairman, happy to stand for any questions.
Thank you, Director. On page 4 of the bill, there's a definition of healthcare institution. I didn't go look this up. I just assumed it was the entities that you actually license. Is that accurate or is that inaccurate? Thank you.
Mr. Chairman, that's generally accurate. So the healthcare facilities or institutions that on the state side that we have licensure authority over are limited: hospitals, nursing homes, boarding homes, assisted living facilities. There are healthcare providers that we do not have licensure authority over, including offices of private physicians, podiatrists, dentists, et cetera. So there would be some that would be excluded. Again, speaking to my point on the limited authority we have on our regulatory end already, certainly over the specific practitioners like the physicians, nurses, psychologists that would be in those facilities. We do not have that authority.
Okay, thank you very much. Questions? Director Johansson, questions? Just one more on that institutions. How many facilities does the state of Wyoming have that they would be subject to? They would be subject to this?
Mr. Chairman, we operate 1 licensed hospital, 3 licensed nursing facilities, an assisted living facility, and an intermediate care facility. Again, we certainly have managerial oversight over those institutions since they are public facilities operated by the Department of Health. But again, in terms of the physicians, nurses, et cetera, their practice of medicine, while we might govern their day-to-day and the services they provide our clients, the practice of their jobs is really governed by the various boards or licensure authorities over that practice.
Okay, thank you. Any questions? Mr. Bonenblus, thank you very much.
Mr. Chairman, Kevin Bonenblus, Board of Medicine. I'll be very quick. First off, thank you to Director Johansson. We would likely need rulemaking authority to be able to enforce any of this. But separate from that, in going to page 10, lines 5 through 18, a subsection E of section 104, I think, that is really problematic because although the sponsor of the bill described it as being actions brought because of acts of conscience by providers, actually the way it's written, it would be any action brought on licensing. You notice line 9, with notice of any complaint or action to suspend or revoke, and it has no reference to the rest of the bill or the language. So what that's doing is that's imposing a whole new set of requirements for licensure actions on top of the Wyoming Administrative Procedure Act, the various rule sets adopted by different agencies, et cetera. So to avoid that, I would recommend that if you are going to keep the bill, strike lines 5 through 18, because I think what they're doing is they're piling on and trying to do something that's already in place, and in so doing, confusing the whole process. And then last thing that I would note is, I think you always have to think about these things as double-edged swords. There's a bill going through the body right now that requires an ultrasound before a chemical abortion. What if a provider says, I don't think that's ethically right, I'm not going to do the ultrasound? Or what if a provider says, I'm going to go ahead and perform an abortion because I think this person needs to have one, even though it's prohibited, but there's immunity from criminal liability in this bill. There are tons of unintended consequences here that and let me say this too, the Board of Medicine has never taken anybody on any kind of First Amendment rights. In fact, the board has told people from other states when they complain about our licensees, go away, they have First Amendment rights. So I would just say that this is, you may be launching something here you don't really want to live with down the line, but that's just my suggestion.
Thank you. Questions for Executive Director Bonenblust? Senator Hutchings.
Thank you, Mr. Chairman. Director, this bill came to us clean. It's not engrossed. Did you bring up these concerns earlier to the bringer of the bill? Thank you.
Go ahead, Mr. Bonenblust.
Mr. Chairman, Senator Hutchings, I did not, because quite honestly, I was all wrapped up in what conscience was and everything else. And so I see that, and yeah, we didn't bring it up. I did mention previously, though, the idea of the unintended consequences, and specifically mentioned the ultrasound requirement for chemical abortions. So, guilty on that count.
Thank you. Further questions? Senator Steinmetz.
Thank you, Mr. Chairman. So what if we made this specific to this act and just inserted language of subsection E for purposes of this act?
Mr. Bonenblust.
Senator Barlow, or Chairman Barlow, Senator Steinmetz, yeah, if you can limit it to this, then that's great, and we can certainly live with that. But right now, it is the whole universe, not this little subset.
Thank you.
Thank you. Executive Director Moritz, please, Dr. Moritz. Anybody else that's want to testify, come on up, fill chairs.
Mr. Chairman, thank you. Dr. Ben Moritz, Executive Director of the Community College Commission. As the bill currently reads, healthcare professionals include students in the nursing and therapeutic or behavioral and medical school students. If there are more unanticipated consequences when it comes to students receiving training so that they are well prepared to deal with a wide range of medical situations. The curriculum that is provided to them may cover areas that they disagree with. But in order for them to be trained to really be able to deal with the number of situations that a medical professional may encounter, they need to be able to react and to treat these types of situations. As it is seen now, it could be anticipated that a student could refuse to do certain pieces of the training. They would receive perhaps a grade reduction on that, and that could be seen perhaps as discriminatory based on this bill. One perhaps solution to this would be if the focus really is on the healthcare providers themselves to remove the students. It could be argued that a healthcare provider needs to be trained in all of these situations. Once they are a healthcare provider, then making sure that they have the ability to use their conscience as they see fit is more appropriate. These are some of the concerns that have come up from the presidents, from the nursing programs, and some of the other areas within the colleges. And so I bring them before you. Thank you.
Thank you very much. Questions for Dr. Moritz? Senator Hutchings.
Just a quick one. Thank you, Dr. Morris. If I was a student and a particular training was brought up that I just know I have a conscience that says I am not going to do this, I would be willing to receive the grade reduction without bringing up discrimination. So I don't see that as a good argument, really. Thank you.
If you want to respond, you're welcome to. That was more of a statement, but if you want to respond, you're welcome to.
Well, thank you, Mr. Chair and Senator Hutchings. I think I would react to it the same way you would, Senator Hutchings. The colleges deal with a lot of students and have seen a lot of situations. And so these concerns come up because, again, unanticipated consequences.
Thank you. Go ahead, Mr. Winnie, then we'll go to Mr. Boley. Anybody else want to visit on this? Come up, fill the empty chair. Mr. Winnie, please proceed.
Mr. Chairman, Bill Whitty, Sublette County. We live in a world sometimes today that is one of newspeak, where we redefine longstanding definitions. Some 50 years ago, I moved to Idaho Falls when the Navy sent me out there. There was a little hospital not far from the house I rented, operated by the Catholic Little Sisters of Charity. Poor and indigent health care. They were told they had to provide elective abortions, and they said they would not, and so they closed it down. In this case, this bill is an effort to get around the newspeak that says an abortion of a normal, on-schedule, uncomplicated baby is health care. And that's precisely the kind of thing we want to avoid, which is a doctor, nurse, whatever, should be able to operate within their own set of ethics. Subject to your questions, thank you.
Thank you. Questions from Mr. Winnie? Seeing none, thank you, Mr. Winnie. Mr. Boley.
Thank you, Mr. Chairman, committee members, Eric Boley with the Wyoming Hospital Association. And, we're watching this closely. I think this is a pretty broad net or big net here. And I would share with you, we heard from Representative Ottman about the polling they did of doctors who won't get into medicine because they don't have these protections in place. What I would offer is that what we're seeing in our state is we're having a hard time recruiting doctors into our state because of existing laws we already have, and many, especially in the OB realm. With what's going on with abortions and how broad those are, we have doctors that don't want to come to our state. And I've talked with Speaker Nyman about maybe fixing that as we move forward. I think as you hear more testimony, and I think we should really define what this bill is all about. We heard in the House the testimony that what problem are we trying to fix? We heard that there are three things that some providers are concerned that they ethically don't want to do. And that's abortions, physician-assisted suicide, and gender-affirming care. I would let you know that when we hire people into our hospitals, I don't know exactly how the private practices work, but in our hospitals, they know going in whether or not they're going to be asked to do those things, or if they want to do those things. And if they want to do those things, most of our hospitals, almost all of our hospitals don't do any of these things. But if they want to do them, they'll go find a facility where they can do those things that they want to do. I'm not sure we need this bill. And I would also let you know that there are already protections in place for whistleblowers. There are federal laws in place, there are state laws in place for whistleblowers. So if someone is forced to observe or see something that's against their medical ethics that has to do with fraud or abuse, there are already protections in place for them to report those. So I'm not sure this is a necessary bill, but if we're going to do it, I would say let's get specific and really define what those ethics or conscious acts are and put that in statute. With that, I'd answer any questions. Thank you.
Thank you. Questions for Mr. Boley? Questions for Ms. Boley? Seeing none. Anyone else in the room? Going online? Going online, let's go with Dr. Bartholomew in Powell, Wyoming. I'll be there tomorrow, doctor. Not to see you.
I won't take offense to that, Mr. Chairman. Thank you.
No offense meant.
Dean Bartholomew, family physician in Powell, Wyoming. I'm here really more to take questions, but make a couple of points for clarification. This is a right to refuse for treatment or procedure. This is not a right to refuse the care of a patient. I could not, if this bill were passed, I could not discriminate against a patient. I'm making a choice or decision in stating I am not going to participate in a certain treatment or a certain procedure, independent of who the patient is. And so I'd heard that said before, that this would allow for discrimination against patients, and that is not true. And also, we have focused mainly on providers and treatments, but we are talking about all healthcare workers. And so this would protect not only, yes, the doctors, but we're talking about nurses, we're talking about OR technicians, we're talking about even pharmacists, we're talking about students, and I'll speak to that. And yes, job descriptions should really allow for definition of what somebody wants to do or can do. But we're just talking about other institutions that are run by the states. So if physician-assisted suicide does become law of the land, as I'm sure we will hear bills in the future, what about it's not just the physician, what about the CNA? What about the nurse who works there who may be asked to participate in physician-assisted suicide or medical aid in dying, who was working at that facility beforehand, before the law took place and before that was part of their job description. So yes, it would be great if we could put a list of all procedures that doctors and nurses and OR techs find offensive morally and ethically, but that's gonna be hard to do. And you would find us back probably year after year trying to make changes to those laws and those lists. So for that reason, that's why we do want this to be general, so that we can keep this open for future medical changes and advances. I'm going to stand for any questions.
Thank you very much, Dr. Bartholomew. Any questions for the doctor? Questions? So my inquiry is regarding the standard. A statement of faith might be an individual. We have bylaws and directives, guidelines, mission statements for institutions. But how do you actually understand individuals, the practitioners, all that? How do you actually verify that these are, I don't want to say, maybe genuine is not the right word, but how do you actually understand that some of these things aren't more effluent? They might change depending on the day, they might, et cetera. You have any thoughts on that? We have expectation when you're hired that you may have to do these things. Should there also be expectation on the employee or these individuals that if there are things they do not want to, they have to actually claim those in advance so that it's not something that, oh, I'm just not going to like that. Any thoughts on that, Dr. Bartholomew?
Yes, Mr. Chairman, I do believe that there are, yes, the lists from faith statements would apply to businesses, but I do believe, again, going kind of back to job descriptions, that should be lined out when somebody is hired, so that there aren't surprises. Just in the same way that a employer would want to be protected, I would think that the employee would want to be protected. And I would like to clarify, the good Representative Ottman, I believe it's 7 states, and I'll leave that for Greg Chiffon to speak to. I believe it's 7 states that have passed this law. And most recently, our neighbors to the north, Montana, did this last year. And we've not heard any reports in any of those 7 states of this law being applied flippantly. Today I don't feel like I want to do this, and tomorrow I want to do this. So.
Thank you. So in those 7 states, and this will just be a heads up for Mr. Chiffon, I think the way you pronounced it, how many actually activities or how many times it's actually been done, or is there any way to know that? Thank you. All right, any further questions for Dr. Bartholomew? All right, we have now Mr. Chiffon with Alliance Defending Freedom. Are you available?
Yes, Chairman, I'm here.
Thank you. Go ahead. Thank you, Dr. Bartholomew.
Thank you, sir.
Thank you, Mr. Chairman. My name is Greg Chaffwin. I'm attorney with Alliance Defending Freedom, and I will use my time to address some of the things that have been said today. First, going to the comments about abortion and ultrasounds. Remember, this is a conscience protection to not force doctors into doing something that they have a conscientious objection to. It does not allow doctors, healthcare professionals to do something because their conscience tells them they should do it. It's just saying employers should not be forcing them to do something they think is harmful. So it wouldn't allow people to do abortions. With regards to ultrasounds, if ultrasounds are required by law, if that happens, this works very well too. If somebody thinks they don't want to do an ultrasound for whatever reason, if they have a sincerely held religious or ethical belief that they can assert, fine. If they don't do the ultrasound, the abortion doesn't happen either. Because if the law is no abortion until an ultrasound, and somebody says, I don't want to do an ultrasound, if there is a sincerely held ethical belief, which we haven't seen one about that, if there is one asserted, then they wouldn't do the ultrasound, abortion wouldn't proceed. So that's how that works. With regards to the number of states, that's right. So 7 states have this. Illinois, since 1977, has had laws, and Mississippi since 2006. In the last 4 years, 5 more states were added to that. It works as intended. Healthcare professionals do not assert conscience rights left and right. Their livelihood is still on the line when they are asserting these conscience rights. So they don't do it as a pretext. And courts are very good at weeding out what is a pretextual argument and what is not. Basically, if something is done as an attempted shield, even though it's insincere, courts are able to do that. Going to students, of course. So students, when they are choosing what profession to go into, first, to enter medical school or not, it was said that we don't have OBGYNs. Well, what are the ethical concerns in the medical field of OBGYNs? It's about being forced to do abortions. And if you think that you want to force students to do abortions, well, guess what? People won't even start medical school to begin with, let alone go into the specialty of OBGYN. So increasing, especially then if you think about moms that want a pro-life OBGYN, there's concern there. For for pediatrics, if you're forcing doctors to counsel children to do things that might be harmful, if someone thinks that is not good medicine, they should have conscience rights to object from that too. So this should help have more providers provide more services to patients. Other things that were referenced about the giving notice.
Quickly, please.
Sorry, giving notice, it's based on the previous version paragraph about section D, talking about complaints about free expression. It could be linked to that, and that would make sense. I'm free for questions for anything else that you might have, but in the interest of time, I will conclude my remarks there.
Thank you. Just for the members and for the audience. So it's 2:00. We are gaveling in. We're going to finish public testimony, and then we're going to reconvene upon adjournment and finish this bill on behalf of Representative Ottman. So Senator Stein has a question for Greg.
Thank you, Mr. Chairman, and thank you for being here. I just have a question about the bottom of page 7, and then over on page 8, when you have no person or entity, including the state and its political subdivisions. We just had another bill where no person was fairly broad. can you give me an example where including that broad language would be the most appropriate rather than just entity or the state and its political subdivisions? What were your thoughts there in drafting?
Go ahead, please.
Certainly, well, to explain the language, person, that would be corporate entities. So you think of an employer that would be targeting an employee that has a conscious objection, unable to do something. So for sure, the state, that makes sense. But if there is an entity, the corporate person that would be forcing, that would apply to them as well.
Thank you. Further questions? Senator Hutchings? No? Okay, thank you. Further question? All right, thank you very much for your testimony. No one else online? Excuse me? No one else online? Anyone else in the room? I didn't see any other hands earlier, so just checking. Anyone else in the room? All right, thank you very much. So we will take this bill up upon 10 minutes upon adjournment of the Senate. You've given your testimony. If you want to make any final comments, you're welcome to, or shoot us an email. But if you'd like to now, you're welcome to. Senator Crum is Committee of the Whole Chairman, so he wanted to be on time. Senator Scott probably needed a break like I do, so go ahead.
Okay, I just wanted to say, again, I appreciate you working with me on this because of being elsewhere. But just to keep in mind too, everybody looks at a bill according to the way that it affects them. So I understand the different testimony. But just a reminder that here not too long ago, I could go to some pharmacies and get the protocols that I wanted for myself, and other pharmacies where I couldn't. They were making decisions, but there was a lot of pushback. This is not to be overreaching to take away anybody's rights, but for the people that are being discriminated against, the ones that cannot continue going to school, the ones that cannot find a doctor, the ones that cannot find a job, those things. This is for their protection. And that's why I ran it. And it is a thing. Discrimination is very, very awful. And people have been aggressively harmed. And so it's time to help the people that want to work and want to be in this profession, but they have certain things that they believe that shouldn't be in their scope of practice. And so I'm here today to represent them. And so thank you. I will see you 10 minutes after adjournment.
Thank you very much, Representative Ottman. You'll arrange those for that for us? All right. Thank you very much, everyone. We appreciate you, and we will be back.